Antioxidants are compounds. They have the ability to neutralize the damaging reactive oxygen species. Since reactive oxygen species are involved in the development and the progression of tinnitus and hearing loss, antioxidants represent a promising therapeutic strategy. N-acetylcysteine is a naturally occurring antioxidant, and it's been used for years to treat acetaminophen overdose and to break up mucus. It also increases the production of glutathione, one of the most prevalent antioxidants in the body. N-acetylcysteine has been studied as a potential therapeutic agent to protect hair cells from damage due to excessive noise. A 2011 study on military recruits found that N-acetylcysteine was able to protect the cochlea from damage due to the noise from firing a gun in an enclosed space. Animal studies have also found that N-acetylcysteine has a protective effect against continuous loud noises, as well as impulse noise. Another animal study showed N-acetylcysteine may reduce noise-induced hearing loss, even if administered after the exposure to a dangerous level of noise. The N-acetylcysteine has generated interest in the field of hearing loss because it's safe for human consumption, and it's already been approved for some uses in humans. Mitochondria are the energy power plants of the cells. They're also the site of reactive oxygen species production, especially when the cell is under stress. In cochlear hair cells, mutations in mitochondrial DNA and declining function of the mitochondria have been found to cause age-induced hearing loss. As a result, compounds that help to maintain the mitochondrial health, like acetyl-L-carnitine, might help to protect the cells from damage. Animal studies have found acetyl-L-carnitine is able to protect the cochlea from both continuous and impulse noise damage, as well as to prevent loss of hair cells. Acetyl-L-carnitine was also found to reduce mutations in the mitochondrial DNA, suggesting it could prevent not only noise-induced hearing loss, but also age-related hearing loss. Much like N-acetylcysteine, acetyl-L-carnitine appears to be effective even when administered after the exposure to loud noises. In one animal study, acetyl-L-carnitine was shown to protect against the otoxicity induced by chemotherapeutic drug cisplatin. Lipoic acid has been found to reduce age-related hearing loss. Preliminary animal studies have also found lipoic acid can help to protect against noise-induced hearing loss and preserve inner ear mitochondrial function. This may be partly due to the effect it has on glutathione. Studies have found increasing glutathione levels help to protect the cochlea from damage due to loud noises. In one lab study, lipoic acid was shown to increase glutathione levels in the nerve cells, protecting from damage. Lipoic acid might also be able to counteract the action of toxins like carbon monoxide that aggravate the effects of noise and make normally safe levels of volume harmful to the ear. In a clinical trial among 46 elderly subjects with hearing loss, 8 weeks of treatment with lipoic acid at 60 mg per day, combined with 2 other free radical scavengers, vitamin C at 600 mg per day, and rebempide at 300 mg per day, significantly improved the hearing at all frequencies tested. Dietary supplementation with vitamins that have antioxidant capabilities can help to protect the hair cells of the cochlea. One animal study showed a 35-day pre-treatment regime of vitamin C might be able to protect against noise-induced hearing loss. Similarly, supplementing animals with certain forms of vitamin A and vitamin E has also shown significant protective effects. The length of time that vitamins need to be taken prior to noise exposure might vary depending on the vitamin. For example, vitamin E appears to be effective with 3 days of pre-treatment. Vitamin A might only require 2 days to be effective, and vitamin C might require a longer pre-treatment period. In addition, taking vitamins in combination might be more effective than any one of them alone. For example, a combination of B vitamins, vitamin C and E, and L-carnitine protected rodents from cisplatin ototoxicity. Folate and B12 are important for the functioning of many cells in the body, including the nerve cells, and they also help to reduce the levels of homocysteine, a potentially toxic compound found in the body. Elevated homocysteine levels are linked to an increased risk of hearing problems. B12 injections 1 mg for 7 days, followed by 5 mg on day 8, protected against noise-induced hearing loss in healthy volunteers aged 20 to 30. Researchers have found that patients with low levels of folate in their blood are more likely to develop hearing loss, and that low B12 levels are associated with hearing loss and tinnitus. Because loud noises impair blood flow to the cochlea, researchers have also examined compounds that can help to improve the circulation to the hair cells and prevent their death. Magnesium is known to help to expand the blood vessels and to improve circulation. It also helps to control the release of glutamate, one of the major contributors to noise-induced hearing loss. Animal studies have found magnesium deficiency increases the risk of noise-induced hearing loss. A combination of magnesium and other antioxidants might synergistically prevent hearing loss, potentially because of magnesium's ability to increase blood flow, and this also helps transport the protective antioxidants. Other animal studies have determined that magnesium can protect against impulse noise damage. Magnesium's benefits have been demonstrated in human trials also. Magnesium supplementation reduced noise-induced hearing loss in men aged 16 to 37. Studies have also found that both intravenous magnesium and oral magnesium supplementation might be beneficial for other types of hearing loss, such as sudden sense and neural hearing loss. Melatonin is a hormone critical for healthy sleep, and it has powerful antioxidant properties. Animal studies have found that it's effective at preventing hearing loss after exposure to loud noises. It's also effective at the treatment of other types of hearing loss caused by reactive oxygen species, such as due to chemotherapy drug cisplatin. Researchers have discovered the potential for the melatonin to act as a protectant against age-related hearing loss. For example, it was noted in a study that low plasma levels of melatonin were associated with significant high-frequency hearing loss among elderly subjects. Additionally, melatonin has been tested as a treatment for tinnitus, both in combination with the medication sulpiride, an atypical antipsychotic, and on its own. On its own, melatonin provides relief from tinnitus, especially in people with significant sleep problems. When combined with sulpiride, the melatonin reduced the perception of the tinnitus by diminishing the activity of dopamine, a chemical in the brain. In one study, sulpiride alone relieved tinnitus in 56% of the subjects, while melatonin alone reduced tinnitus in 40%. However, when combined, 81% of the subjects reported relief from their tinnitus symptoms. Ginkgo biloba is a commonly used herbal supplement, and it's attracted interest as a means of protecting against hearing loss, as well as a treatment for tinnitus. Early animal studies has found that when a standardized preparation of Ginkgo extract was given as a supplement to animals, it reduced behavioral manifestations of tinnitus. This extract, at a dose of 160 mg per day over a 12-week period, was also effective at reducing symptoms in humans. However, other studies have found negligible or no effect. Therefore, more research is needed in the area. Ginkgo biloba may also be effective at preventing hearing loss that causes tinnitus. An animal study found Ginkgo biloba extract was able to reduce drug-induced oxidative damage to the hair cells in the cochlea. CoQ10 supports mitochondrial function, and it has significant antioxidant properties. Animal studies have found supplementation with CoQ10 reduced noise-induced hearing loss and the death of hair cells. Human studies have also yielded promising results, as 160 to 600 mg of CoQ10 daily was found to reduce hearing loss in people with sudden sense and neural hearing loss. Also, a small preliminary trial found CoQ10 supplementation alleviated tinnitus in those with CoQ10 blood levels who were initially low. Another small trial found CoQ10 might slow the progression of hearing loss associated with mitochondrial genetic mutations. Zinc is a mineral involved in many physiological processes, including nervous system function, and it has antioxidant and anti-inflammatory properties. Evidence suggests that the inadequate zinc intake might be associated with impaired hearing. Researchers have found zinc supplementation might be helpful in treating some forms of hearing loss. In addition, low levels of zinc correlate with perceived loudness of tinnitus in afflicted individuals. Long-chain omega-3 polyunsaturated fatty acids, long recognized as important for health, might also affect hearing loss. A preliminary study found participants with the highest blood levels of these beneficial fats suffered the least amount of hearing loss over time. In another study, greater fish and fish oil consumption was associated with less hearing loss among nearly 3,000 subjects over 50 years of age. The authors remarked that dietary intervention with omega-3 polyunsaturated fatty acids could prevent or delay the development of age-related hearing loss. Taurine plays a vital role in hearing. In fact, studies have found in some cases taurine can reverse the biochemical processes behind hearing loss. Other studies have demonstrated that taurine can almost completely eliminate the ringing in the ears that's associated with tinnitus. Much of the damage to hearing occurs not in the mechanical parts of the ear, but rather in the nerve cells that convert the sound waves into electrical energy that's perceived in our brain. Like other nerve cells, these so-called hair cells depend on the flow of calcium ions in and out of the cell. Taurine helps to restore and to control the normal calcium ion flow in the auditory cells. Taurine improves the hearing ability in animals who are exposed to drugs like the antibiotic gentamicin, which is notoriously toxic to hearing. Animal studies using human equivalent doses of 700 milligrams to 3.2 grams per day of taurine over the course of several weeks have demonstrated near complete resolution of tinnitus with taurine supplementation. The animals had been trained in tasks that are sensitive to the distraction by tinnitus. And a human pilot study has shown encouraging results with 12% of the people responding to taurine supplementation. For more on herbs, supplements and natural treatment plans, check out my website.